Hello, this is Augustus Fernandez presenting my final project. My project will examine the theorist Nola Pender and her health promotion model. Nola Pender was born in 1941 in Michigan and has been a nurse educator for more than 40 years. Nola Pender became a nurse in 1964. In 1969, she earned a PhD in psychology and education from Northwestern University. She is a distinguished American nurse and health theorist. She also inducted into the American Academy of Nursing in her later years. She is best known for the health promotion model theory, which was introduced in 1982 to go alongside the traditional disease prevention focus in treating patients. This theory is considered a mid-range theory. It's very easy to apply the key concepts into situational specific treatment. Health promotion model is a behavioral focused theory. It helps guide providers to encourage patients to engage in healthier behaviors that will improve their future health. It also helps to do a self-evaluation of benefits and barriers for the patient. Health promotion model emphasizes the proactive role of patients in managing their own well-being. It focuses on the psychological and social aspect that affects health behaviors in patients. The model is centered on the patient's characteristics and experiences. For example, prior health behaviors such as biological and sociocultural influences, behavioral cognition of the patient, for example, the patient's perspective of themselves, their level of competence, interpersonal and situational influences. Behavioral outcomes are the last key component for health promotional model. This is the main goal for the theory, in which health promoting behavior results in a better, healthier lifestyle for the future of the patient. It's a holistic approach to patient-centered care in nursing practice. Using Millet's table, Pender's health promotion model has clarity, empirical, adequacy, and utility in its framework. The theory promotes healthier behavioral changes through empowering the patient and educating them about their health. It helps guide preventative care. However, the theory needs more research about very diverse cultures that have different motivational triggers and healthcare access. My reasoning for health promotional model is that I believe that patients' health is in their own hands. I love hearing patients relate back to their food and exercise as a focus in their daily lives. Also, nutrition is one important key component to anyone's well-being. All these aspects will help patients be more informed and add part of their healthcare and future treatments. They will feel empowered by being proactive through health promotional model. Pender's health promotional model helped shift the focus on nursing from disease prevention to health promotion by using words like empowerment to guide a patient-centered model. Examples are used as a preventative care. According to Bandura's social cognitive theory, a person learns through observation, imitation, and modeling, and that learning occurs throughout a person's lifespan. There are four parts of modeling or observational learning: attention, retention, reproduction, and motivation. In Pender's health promotional model, it has similar elements of recorporal determinants. Recorporal determinants is defined as mutual influences among a person's behavioral thoughts and beliefs and their own environment that will ultimately influence their state of mind, behavioral attitudes, external factors, and social factors. All this leads to a person's self-efficiency and their ability to succeed in whatever way they see fit. Adults continue to learn through social interactions, whether at work, social engagements, or through any type of modern media. Self-efficiency is even more important during adulthood because it affects careers, how people handle challenges, trauma, and how one views their life. There is a strong sense that social influences and environmental aspects shape a person during their adulthood stage of life. Ludwig's general theory is one of the main concepts that moved nursing practice further into the modern-day practice. Ludwig von Bertalanffy was a biologist who published his general system theory in 1968, and its key theme is interconnectedness, and that complex ideas and systems share principles which can be found and copied with the help of other systems. General system theory describes how different components of a system interact and influence others. The theory viewed that instead of examining parts of an idea in isolation, systems should be understood as a whole. This theory can be applied to families, living organisms, groups, communities, and patients, which all consist of interconnected parts that speak, adapt, and influence each other too. The theorists propose that all that we can understand in the world is interconnected with each other, and vice versa. So we should study interconnectedness as a means of understanding the world. In terms of this theory, we now look at systems that is being interconnected with all parts. Let's draw a stick figure in your mind, which represents a patient, and the grand general system theory has influenced nursing practice by advancing its skills to treat people by using a holistic approach and care plans. So think about an environment, a community, family, and then the individual. All these examples of influences the patient and should be noted when treating the individual. Grand general system theory emphasizes the importance of all these key points, making these the foundational theory in understanding complex framework in biology, health, and society. System made up of interrelated and interdependent parts. Boundaries defines a system and distinguish it from other systems. Adaptation, the ability to make the internal changes to protect itself and keep fulfilling its purpose. And feedback loop, processes by which systems self-correct based on reactions from other systems. Think of a whole is greater than all its parts. Baking a cake is a basic example that we can all do an exercise with. Let's do an exercise. Think of all the ingredients for a basic cake. If you were to spread all of these ingredients out, you would have flour, water, eggs, sugar, baking powder, and frosting as some of the main parts of a cake. But if you were to spread all of these ingredients out, you still would not have a cake. But it's important to look at all of the ingredients and the small things that make up the whole. You would only have the ingredients of a cake for right now. So, general system theory has a holistic approach to viewing subjects. You need to seek all the information first before seeing the whole to achieve a positive outcome. Nola Pender's health promotional model grows on the ideas from general system theory. The health promotional model approaches patients as part of a larger system, social, environmental, biological, that changes health behaviors. In the health promotion model, patients connect with their community and can work for self-regulation and finding autonomy that promotes their future health. The main items on health promotional model are self-efficacy, individual experiences, behavioral outcomes, and patients' own personal understanding of their health and future. Just as general system theory explores the interactions within systems, Pender's model focuses on how personal and interpersonal factors like the self-efficacy, social support, and motivations interact within broader environments to change health behaviors. The key word in Pender's theory is empowerment. In this theory, this key theme is similar with general system theory concepts of the individual actively engaging with their environment to promote positive outcomes in the future. In my career, I've witnessed many situations where the patient never got a holistic experience in their care at the hospital. Many patients whose primary team is ortho or general surgery has this outcome. I believe the lack of a holistic approach is because these teams are very specialized in their field but forget to see patients as a complex whole system, and they only see their chief complaint and diagnosis. For example, general surgery looks at a broken arm and then fixes the broken arm. Many times they don't examine the history behind it, the patient's personal understanding of their health, patient's level of self-efficacy, support system, and external factors that goes along with the whole plan of care for one person. Advanced nursing practice applies to the health promotion model by seeing patients holistically as complex individuals as being influenced by a variety of internal and external factors. Their support systems like families and friends, relationships, their communities, their DNA, and environments. Advanced practicing nursing understands not only the biological aspects of care, but also social and psychological influences that changes a patient's health. Concepts include holistic care, treating the whole person, patient-centered care, respecting the individual's role in their health, interdisciplinary collaboration, working with different healthcare teams. Examples of this would be watching a nurse assess their new patient and examining their psychological, biological makeup, social dynamics, and then talking with other medical teams about the plan of care and treatments. That example is a great way to see the influence of health promotion the model has on advanced nursing practices. Nurses use assessments to examine the entire patient's situation, considering how factors from genetics to lifestyle and social aspects interact to change health outcomes. The ability to see patients as part of a complex human helps guide nurses to develop more understanding and tailor care plans to the individual. Health promotional model emphasizes the importance of seeing patients as interconnected with their care and empowering the patient for a better future. Pender's most impactful influence is the use of health promotional model and how providers now help patients to understand and empower them within their own treatment plan and future. In terms of the nurse practitioners, understanding these key concepts unlocks doors for more fluent, holistic plans of care that empowers individuals to take control of their present and future. The real connection between health promotional model and daily practices are testable and measurable. It's a very practical theory based on whatever specific situation is being focused on. The elements in health promotion model connects to how providers should use a holistic approach when developing a plan of care for patients. It should help guide patients to feel their autonomy and empowerment during the planning process. Health promotional model influenced psychological and social factors for nursing theories by focusing on empowerment, behavioral, and cognition factors, preventative health and wellness, and the development of health behavioral theories. Examples are theories like the chronic care model and Orm's self-care deficient theory. Both focuses on empowering patients to manage their own issues and future health. I have an infographic diagram on the next slide to give more visual aspects to Pender's theory. This will help the reader understand the theory better through a visual art. Also, printed versions can help patients understand their role in healthcare and how being empowered can change their current state of mind and present health. My infographic shows health promotional model in visual form. It's to help visual learners and to have more of a in-depth, thorough examination and description in a poster-like form. In summary, Pender's health promotional model has influenced a lot of people and helped center on behavioral changes, self-management, and health promotion, shifting advanced nursing practice closer to a more holistic approach with a long-term goal of healthier living and preventative care. Empowerment and active involvement are the main takeaways from this model. Providers should always have a holistic approach when testing patients in healthcare. This will have positive outcomes for all our futures.